Today, I'll talk about vitamin D and the role that it plays in your health and overall well-being. Vitamin D is an incredibly important nutrient for our bodies, but between 30 and 80% of people living in the US are actually deficient. And being deficient can have a lot of negative health consequences. It's been associated with a higher risk of diabetes, neurological disorders, different types of cancer, high blood pressure. Typically, our immune system is going to be weaker when we're deficient in vitamin D, and we're also more likely to lose muscle mass as we age. Even though it's called a vitamin, our bodies can actually produce vitamin D when we get natural sunlight outdoors. But if you're getting that sunlight through windows or if you're wearing sunscreen, you're not going to get much, if any, from the sun. Another thing to keep in mind is that during the winter time, most of us in the US will get very little, if any, vitamin D from the sun, even if we're spending a lot of time outdoors. People living in the South, like Texas, New Mexico, or Florida, will get some, but anyone living in the middle of the country or north will pretty much get nothing for a good part of the year, regardless of the amount of sunshine you're getting. So this is likely a contributing factor to people getting sick more often in the wintertime, and overall just feeling more depressed with things like seasonal affective disorder. We can get vitamin D from food, although it's mostly going to be from the foods being fortified, meaning the vitamin D is added to it. You're not going to find significant natural vitamin D in almost any foods, which is why people often turn to supplements. The best way to figure out if you're deficient is to ask your doctor to test your vitamin D levels if they're not doing it already. And then depending on the results, they may recommend that you take a supplement. But there can be some pretty significant improvements with how people do and how they feel when they go from really low levels of vitamin D and they bring it up to more optimal levels. So it's definitely something that I'd investigate with your doctor, whether or not you think you're deficient. But it's even more important if you're someone who tends to get sick often or if you're feeling extra run down, especially during the winter months. So you should definitely try to spend time outside in the sunlight whenever possible. Even in the winter months, there are benefits to being out in daylight, so don't worry about it. Even if you're not getting much vitamin D from the sun, you should still try to spend time outdoors. And while sunscreen will be important when you're going to spend long periods of time outdoors or if you're going to be in very intense sunshine, for shorter periods of time when you know you're not going to get burned, you may want to give your skin a chance to get some natural vitamin D. Obviously, there's different considerations for different people with different health backgrounds, but getting 15 to 30 minutes of sun during the middle of the day can put you in a really good place with your vitamin D levels if it's during that spring or summer or fall time when we are getting vitamin D from the sun. And as I mentioned, it's worth having your doctor take a look at your levels, especially during the winter, to see if supplementing with vitamin D can be helpful for you. But if you can get your vitamin D levels to a good place, you're going to set yourself up to feel better and just have a much better chance at living a longer and healthier life. Let me know if you have any questions. Thanks for listening.